Cool. Well, I'm going to take us out of tech world for a second and just talk about something that everybody in this room interacts with, which is healthcare. We have a massive problem in healthcare, not just in this country, but across the world. There's a major capacity issue, right? There's not enough clinicians, and not enough trained staff to actually see and treat everybody on planet Earth. Just in this country alone, the spending that we do on administrative tasks, so the things that are not aligned to actually delivering care between a clinician or a patient, is about 25%, representing about $600 billion to $1 trillion just in the US. This is a massive problem, and we think AI, and specifically agents, are the best suited solution we have to solve and address this massive inflation in healthcare cost. And healthcare's changed a lot, right? If we think about what healthcare was maybe 50 or 60 years ago, right, it was a single one-to-one relationship between a doctor and their patient. Well, healthcare's evolved, right? Care pathways have changed. There's so much information and complexity in treating every single human being due to their unique lifestyle, their genetics, and then you also have to combine that with, billing systems on the back end. You have to do adequate coding. You have to get the right authorizations from a payer. There's 1,000,001 tasks that an individual or a system needs to do in order to provide care. That's not necessarily the diagnostic relationship between, again, the patient and the clinician. And this is what Nimblemind is addressing first. How do we optimize that and build quality workflows that can automate those tasks and free up hours for clinicians to spend more time with their patients? Now, to do this, it's not simple. A lot of folks have kind of implemented copilots and brought LLMs into these types of workflows, but it's missing 3 key ingredients. You need to be able to do predictable, structured, consistent tasks. You need to enable humans in the loop in a systematic way, right, and expose low confidence decisions to experts when appropriate. And then you need to build objective-driven workflows. And there's many of these in healthcare. It's very complex. So this is the secret sauce that Nimblemind is addressing. We're pulling all these 3 things together and automating what we call end-to-end healthcare knowledge work. So we find the relevant information across all the myriad systems that exist in a provider. We understand the context and exceptions. We complete the multi-step workflow and highlight things that might need a human in the loop. And then we return a traceable output to the user. And the way we do this is with specialty-specific models. I was talking to Matt White in the green room before coming out here. He was on stage maybe 3 or 4 sessions ago from the Linux Foundation. And him and I agree where these small-scale, domain-specific models are the path forward, and that's what we're doing. We're training and building our own models that align to how healthcare is practiced today, which is specialties. So we have models that work on oncology, on pathology, on radiology, nephrology, and a whole long list of others that aren't on the slide. And by combining these models together and building a system of experts, we're able to do high-quality, consistent, durable tasks in healthcare that can win confidence of clinicians and drive the right outcomes for patients. Well, what's one example of this? Well, we recently published a paper with Sing Health. I'll be presenting this on October 8th at the DAIH conference here in San Francisco. We're working with pathology reports. So what Sing Health wanted to do was look at over 2 million different pathology reports and find missed cases of H. pylori and gastritis. Now, if a human were to do this, they'd spend something around like 82 hours per 1,000 reports. You can do the math of how that would scale up to 2 million reports. We were able to save them over 99% of the time and do it at an accuracy that was well above the threshold for their internal teams and acceptability, and to highlight, again, the cases where we needed human intervention. We were able to do this in less than a week. The product is live. We're about 2.5 years old. We're venture-backed. I didn't want to risk it with a video, so these are just going to be still shots of the product, but you can go on and sign up. We build a lot of scalable APIs that you can integrate with. We kind of white label our product to a lot of different health tech companies that are in the market today. And something that I'm very excited about is we also have a new feature where you can orchestrate and kind of build your own workflows. So a lot of our maybe not so technical users at providers are building and designing their own workflows and going live with them in our model framework that's safe and consistent and effective for the healthcare setting. We've got about 100 different customers that we work with around the world. Some of our research partners and customers are listed here. I won't go through them, but some of the world's top institutions in the AMC or medical space. I invite you to read our papers. We're published and presented at NeurIPS, at ML4H, And recently, we're going to present at DAIH, and we recently presented at SAIL as well. All of our papers are available for you to read. If you're interested in healthcare, I invite you to take a look at those. And just a quick background on me for the investors in the room. I came from AWS and Stripe. I helped launch over 40 different products, including Alexa for Health and the first Epic deployment on AWS. My co-founder, Naveen Kumar, who's our chief AI officer, has a PhD from Yale and was the data science lead at New York City's Health and Hospital Systems. Thank you for the time. Appreciate you all. Cheers.